Hi, my name is Alex and this workshop is brought to you by Ethical Health Solutions, where healthcare solutions are ethically crafted. Hello, I'm Alex. Welcome to part 4 of Exploring Healthcare Ethics, a workshop for healthcare professionals. Today, we will focus on cultural competence and ethical decision-making. We will explore the cultural factors influencing ethical decision-making in healthcare and discuss strategies for promoting cultural competence while addressing ethical challenges in diverse patient populations. Let's get started. As mentioned earlier, we will be working on case studies during this workshop. Feel free to pause the video or wait for the loading bar to complete. For the first case, cultural factors in ethical decision-making. Cultural norms. Each culture possesses distinct norms, values, and beliefs that shape individuals' ethical perspectives and decision-making processes. Communication styles. Differences in communication styles, language preferences, and nonverbal cues can affect the ethical interactions between healthcare providers and patients from diverse cultural backgrounds. Health beliefs and practices. Cultural beliefs regarding health, illness, and treatment methods can influence patients' treatment preferences, adherence to medical recommendations, and perceptions of ethical care. I will allow a few moments for reflection, after which we will engage in a discussion regarding the questions surrounding the scenario. The time is up. We can now proceed to the discussions about the case. For example, a healthcare provider is treating a patient from a cultural background that places high importance on traditional healing practices. The patient prefers to use herbal remedies and consults a traditional healer before accepting conventional medical treatments. The provider must navigate the patient's cultural norms and beliefs to respect their choices while ensuring they receive appropriate medical care. Effective communication. Understanding the patient's health beliefs and finding a culturally competent approach to integrate traditional and modern treatments are crucial in this scenario. We need to consider cultural factors in ethical decision-making for several reasons. Respect for diversity. Healthcare environments are increasingly diverse, and respecting different cultural norms and values is essential for providing ethical and equitable care. Understanding these differences helps in respecting patients' backgrounds and choices. Improved communication. Recognizing variations in communication styles, including language preferences and nonverbal cues, enhances the quality of interactions between healthcare providers and patients. This understanding can prevent miscommunications and ensure that patients fully comprehend their treatment options and medical information. Patient-centered care. Awareness of cultural beliefs and practices related to health, illness, and treatment enables healthcare providers to offer care that aligns with patients' cultural contexts. This can lead to greater patient satisfaction, improved adherence to treatment plans, and better health outcomes. Ethical sensitivity. Considering cultural factors in decision-making fosters ethical sensitivity, ensuring that healthcare providers make decisions that honor the cultural identities of their patients. This is crucial for maintaining trust and integrity in the patient-provider relationship. Addressing disparities. By promoting cultural competence, healthcare providers can better address ethical challenges and disparities that may arise in diverse patient populations. This leads to more inclusive and fair healthcare practices, reducing the risk of bias and discrimination. Overall, incorporating cultural factors into ethical decision-making is fundamental to delivering high-quality, respectful, and effective healthcare in a multicultural society. Second case, ethical challenges in culturally diverse settings. Language barriers. Limited proficiency in English can impede effective communication and the process of obtaining informed consent, resulting in ethical dilemmas. Health disparities. Cultural factors contribute to disparities in access to healthcare services, quality of care, and health outcomes, raising ethical concerns regarding equity and justice. Respect for cultural autonomy. Balancing respect for cultural autonomy with universal ethical principles can pose challenges in multicultural healthcare settings. I will allow a few moments for reflection, after which we will engage in a discussion regarding the questions surrounding the scenario. The time is up. We can now proceed to the discussions about the case. Example case. A healthcare provider is treating a patient who speaks limited English and relies on their family for translation. During a critical treatment discussion, the family members may unintentionally misinterpret medical information, complicating the process of obtaining informed consent. Additionally, the patient's cultural background has historically faced disparities in healthcare access, raising concerns about equitable treatment. The provider must respect the patient's cultural autonomy while ensuring clear communication and addressing any potential biases or inequalities in care. Effective use of professional interpreters and culturally sensitive approaches are essential in navigating these ethical challenges. Why is this important? These are important considerations because they highlight the complexities that arise when providing healthcare in culturally diverse settings. Let's break it down. Language barriers. Effective communication is crucial in healthcare to ensure patients understand their conditions, treatment options, and give informed consent. When there's limited English proficiency, it can impede this communication, potentially leading to misunderstandings, inadequate informed consent, and ethical dilemmas. Health disparities. Cultural factors can significantly influence access to healthcare services, quality of care received, and health outcomes. When certain cultural groups face barriers to accessing healthcare or receive lower quality care due to cultural biases, it raises ethical concerns regarding fairness, equity, and justice in healthcare delivery. Respect for cultural autonomy. Respecting patients' cultural beliefs, practices, and values is crucial for providing patient-centered care. However, in multicultural healthcare settings, there may be tension between respecting cultural autonomy and upholding universal ethical principles such as beneficence and non-maleficence. Finding the right balance while ensuring ethical care for all patients can be challenging. Addressing these ethical challenges requires healthcare providers to be culturally competent, understanding and respecting the cultural diversity of their patients while upholding ethical principles and ensuring equitable access to quality care for all individuals, regardless of their cultural background. The next case is strategies for promoting cultural competence. 1. Cultural awareness. Increasing awareness of one's own cultural biases and assumptions is essential for providing culturally competent care. 2. Cultural knowledge. Educating healthcare providers about the cultural beliefs, practices, and healthcare needs of diverse patient populations enhances cultural competence. 3. Cross-cultural communication. Developing effective communication skills, such as active listening, empathy, and linguistic competency, facilitates meaningful interactions with patients from diverse cultural backgrounds. I will allow a few moments for reflection, after which we will engage in a discussion regarding the questions surrounding the scenario. The time is up. We can now proceed to the discussions about the case. Case study. Promoting cultural competence in healthcare. Scenario. Dr. Patel, a primary care physician, works in a diverse urban community where patients from various cultural backgrounds seek medical care. She wants to ensure that her practice is culturally competent to effectively meet the needs of her patients. Strategies implemented. Cultural awareness. Dr. Patel starts by reflecting on her own cultural biases and assumptions. She attends workshops and engages in self-reflection exercises to increase her awareness of how her cultural background influences her interactions with patients. Cultural knowledge. Recognizing the importance of understanding her patients' cultural beliefs and practices, Dr. Patel invests time in learning about the cultural norms, traditions, and healthcare needs of the communities she serves. She consults resources, such as cultural competence training modules and cultural sensitivity literature, to deepen her knowledge. Cross-cultural communication. Dr. Patel understands the significance of effective communication in providing patient-centered care. She hones her communication skills by participating in role-playing exercises and language classes to improve her ability to communicate with patients who speak languages other than English. Additionally, she practices active listening and empathy to better understand her patients' perspectives and concerns. The outcome: by implementing these strategies, Dr. Patel enhances the cultural competence of her practice and improves the quality of care for her diverse patient population. Patients feel more respected, understood, and valued, leading to increased trust and satisfaction with their healthcare experiences. Dr. Patel's efforts also contribute to reducing health disparities and promoting health equity in her community. This case study exemplifies how healthcare providers can promote cultural competence through increased awareness, knowledge, and effective communication, ultimately leading to better healthcare outcomes for patients from diverse cultural backgrounds. The next case is called Culturally Sensitive Ethical Decision-Making, Patient-Centered Care. Embracing a patient-centered approach that respects and integrates patients' cultural values, preferences, and beliefs into ethical decision-making processes. Shared decision-making. Involving patients in the decision-making process and eliciting their perspectives, concerns, and treatment goals fosters collaboration and mutual understanding. Ethical frameworks. Applying ethical frameworks that consider cultural diversity, such as cultural relativism or communitarian ethics, in addition to universal ethical principles. I will allow a few moments for reflection, after which we will engage in a discussion regarding the questions surrounding the scenario. The time is up. We can now proceed to the discussions about the case. Case study: Culturally sensitive ethical decision-making in healthcare. Scenario: Maria is a healthcare provider working in a hospital that serves a culturally diverse community. She encounters a complex ethical dilemma involving end-of-life care for a patient from a cultural background different from her own. The strategies we implemented. Patient-centered care. Maria adopts a patient-centered approach, recognizing the importance of integrating the patient's cultural values and beliefs into the decision-making process. She takes the time to learn about the patient's cultural background, beliefs about death and dying, and preferences regarding end-of-life care. Shared decision-making. Maria engages in shared decision-making with the patient and their family members. She facilitates open and honest discussions, allowing the patient to express their wishes, concerns, and treatment goals. Maria listens actively, ensuring that the patient's voice is heard and respected throughout the decision-making process. Ethical frameworks. Maria applies ethical frameworks that consider cultural diversity, in addition to universal ethical principles. Recognizing the limitations of a solely individualistic approach, Maria explores ethical frameworks such as cultural relativism or communitarian ethics. She seeks guidance from colleagues and ethics committees to navigate the cultural complexities of the situation while upholding ethical principles of beneficence, non-maleficence, and respect for autonomy. Outcome: by embracing culturally sensitive ethical decision-making strategies, Maria ensures that the patient receives care that is respectful, compassionate, and aligned with their cultural values and preferences. The patient and their family members feel empowered and supported throughout the decision-making process, leading to a sense of trust and collaboration between the healthcare team and the patient's cultural community. Ultimately, Maria's approach fosters better healthcare outcomes and promotes cultural competence within the healthcare setting. This case study demonstrates the importance of incorporating cultural sensitivity into ethical decision-making processes, particularly in healthcare settings serving diverse patient populations. By embracing patient-centered care, shared decision-making, and culturally sensitive ethical frameworks, healthcare providers can navigate complex ethical dilemmas while respecting the diversity of cultural beliefs and values among their patients. Now, let's disseminate the knowledge we've acquired to a wider audience by leaving insightful comments on this video. Sharing our insights and reflections can foster a collaborative learning environment and contribute to the collective understanding of the topic discussed in the video. By engaging in constructive dialogue through our comments, we can enhance the learning experience not only for ourselves but also for others who come across the video. Let's leverage this opportunity to share valuable perspectives, ask thought-provoking questions, and encourage further discussion on the subject matter. Together, we can enrich the online community with our diverse insights and contribute to meaningful conversations that extend beyond the confines of this video. In conclusion, cultural competence plays a pivotal role in ethical decision-making within healthcare, as cultural factors intricately shape the values, beliefs, and healthcare encounters of patients. By actively fostering cultural awareness, knowledge, and sensitivity, healthcare providers equip themselves with essential tools to navigate complex ethical dilemmas with greater efficacy. This proactive approach enables them to deliver care that is truly patient-centered, honoring the diverse cultural backgrounds of individuals while striving to promote health equity. Embracing cultural competence not only enhances the quality of care provided but also serves as a cornerstone for building trust, fostering inclusivity, and advancing positive health outcomes for all. This is where this part ends. Please proceed to the next part and don't forget to share your thoughts with us. Leave a comment below or send us an email at info@ethical-healthsolutions.com with the subject line, feedback. Thank you. Alright, don't forget to subscribe and hit the bell button to receive notifications for new videos from us. Goodbye.